Hello, everyone, and welcome to today's session on Health Literacy 2.0 and Workforce Health. I'm so pleased to be joined by Dr. Ron Goetzel, who is a senior scientist and director of the Institute of Health and Productivity Studies at the Johns Hopkins Bloomberg School. I'm Seth Serxner. I'm Chief Health Officer at EdLogix, and we are about to embark on a great conversation. I've known Ron many years, many decades actually at this point, Ron, and consider you a friend and colleague. And I'm just really glad we have a few minutes here together to talk about this topic. But Ron, for everyone else's benefit, can you give a little bit of background on kind of your career path and what that role is that you're in today?
Yeah, sure. Yeah, so back in the 1970s, when I was still in grad school, and working actually four jobs at the same time, I was an idealist. I wanted to be a community organizer. I wanted to change the world, be a change agent. I worked in a variety of roles, including the mayor's office, and did police negotiations and trainings, landlord work, did work with daycare centers and all that. And it was interesting work, but obviously did not pay a whole lot because I had to hold down four jobs,
Just four, okay.
just four. And then in the 1980s, almost by accident, I fell into the business world. There was a young startup company in New Haven, Connecticut that took diagnosis related groups, developed at Yale University, and was applying it to insurance claims data. And this was kind of the first time that employers got a sense of where their money was going. Was it going for hysterectomies? Was it going for bypass surgeries? And we developed norms and benchmarks. And then in the dark of night, we would come up with recommendations. We'd sit around this table, and basically I was the 10th employee of the company. And the president would say, what do you think we should do here? What do you think we should do there? And we came up with ideas like managed care, discounts and networks, and health promotion was one of the ideas we came up with. Why don't we keep people healthy in the first place so that they don't have to pay these very expensive bills? And the company grew from 10 to hundreds, and eventually through the buying process became part of United Health Group as Optum and Ingenix and all those companies. So that's the origin story of some of the data analytics that came about in the 1980s. I moved to Johnson & Johnson and was hired as their vice president of data analysis and evaluation services for a startup company that was focused on health promotion, disease prevention, taking the internal Live for Life program that J&J essentially put together in the 1970s and took it out to market and said, who else wants to try this out? And remarkably, the CEO at the time, Jim Burke, paid $5 million to do research on it. He said, if we've got a program, now we're going to invest a lot of money in seeing whether it works or not. And across all dimensions, practically, it did work. It actually improved health and saved money. And that was a fantastic job, got to meet a lot of great people, wonderful company. And then when I was leaving there, I went to a company called MedStat, which was a startup. It then became Thomson Corporation, Thomson Reuters, Truven Health Analytics, and then IBM Watson Health. So I spent about 26 years in this ever-evolving data analysis role, doing everything imaginable, from running large organizations, which I don't like to do, to being an individual contributor to kind of creative thinking, creative ideas. But the other thing that was interesting that happened around the 2000s, early 2000s, I wanted to go back to my roots. And a colleague of mine who was working at the time for Lewin said, I'm going to Cornell and we're going to start a new center, an institute there focused on health and productivity and disability and want to come along. And I said, sure. And that's how the Institute for Health and Productivity started in the early 2000s at Cornell University. Built a team, got a lot of really interesting work, a lot of federal contracts, did some very innovative research, moved from Cornell to Emory University, and then eventually Johns Hopkins, where I've been for the last 8 years. And up until recently, I had one foot in the business world and one foot in academia. And the idea was to bring these two peoples together in a kumbaya, have them talk to each other, learn from each other, and, kind of give them ideas as to how to connect the business world and public health world. So that's where I am now.
Yeah, I think many people may know of your career. You're one of the most published people in our field. made huge contributions, but it's such an interesting arc, right? To start from the data, but having some core themes. And I think it's interesting because both of us kind of, I also was had this idealism of being some kind of social change, do some good in whatever my career path is going to be, try to help people. And, we kind of both ended up in this area of, well, let's try to help people be healthier and maybe even down the end of the kind of upstream a bit. But you have always kind of managed to keep science and practice, evidence-based, what's the research say, all of that. So given, that long arc, what are the hot topics today that you're focused on? What are some of the interesting kind of research or, the evidence that still needs to be uncovered?
Yeah, I mean, I think what's also unique about you and me, Seth, is that we have focused on the business world. So public health in general focuses on how to get communities to be healthier, kids to be healthier, women to be healthier, and so forth. But it's groups of people. They don't, in my mind, it doesn't really attend to the big picture of who's paying for it all.
Yeah.
And in our society, our capitalist society, it's the business community, employer community paying for all of these services. And there are 170 million people going to work every day. Wouldn't it be nice if they were also exposed to health promotion, health education, and how to better take care of themselves and take care of their families? So I think that's what makes us a bit unique from kind of the traditional public health advocate. The things that I'm focused on now, you can probably put them into three large buckets. One being kind of more traditional program evaluation. So a company or organization would come to us, for example, the World Bank Group or the IMF, or a company like BP or a company like AT&T, and say, well, we've got these programs in place. Can you help us figure out whether they're effective or not, whether they're working or not? What should we keep? What should we discard? What should we fine tune and so forth? And also, while you're at it, give us some recommendations, strategic recommendations of where we should go forward based upon the data. And can you keep track of this? So, we're going to do it now, but we want a year later to see if things are evolving and moving and so forth. So one bucket is program evaluation. The second bucket is kind of a subset of the larger field of health promotion and disease prevention. It's a focus on mental health and well-being. And the reason that's become very topical and very kind of front of mind, largely, I think it's because COVID. All of a sudden, we discovered that people have brains and emotions and feelings and stressors, and that affects their performance. And by the way, they're not even in the office anymore. They're somewhere else. Shouldn't we be attending to the mental health and well-being of employees? And the reason is that that actually does impact the bottom line. We have business to run. We have people who need to be engaged, need to be productive, not worry about stuff. What can we do? So there are a bunch of tentacles that come from there. But the central one, the main one, is we actually got funding from NIOSH, which is the National Institute for Occupational Safety and Health, to develop and sustain a center of excellence focused on workplace mental health and well-being.
Oh, when did that start?
That started, it's almost about 2 years ago. It's a 5-year contract, and there are 10 of these around the country, actually, based in universities. And they've been around for many, many, many years. But our focus is very specifically mental health and well-being. And target population not only includes health workers at our hospitals and clinics, but also food service workers, people working at home, and so forth. So we're looking at all aspects of this and trying to do diagnostic work, kind of how do we know what's here? What are some of the strategies that are effective, that have been shown to be effective in the workplace? What are the interventions that we can put in place, and how do we evaluate that, and eventually put together a set of tools and resources that employers can use to improve the mental health and well-being of their workforce? Mm-hmm. So a lot of that has gone on. We've got meetings and summits and convenings and a bunch of research that's coming out of it, including several literature reviews on the topic. So that's the mental health and well-being bucket.
Right.
And the third bucket, which you're familiar with, is recognition programs. So you and I have worked together, I don't know if it's 3 decades long, but it's many decades long, on the Coop Award, the T. Everett Koop National Health Award, which each year recognizes organizations that have outstanding programs with documentary evidence that their programs have improved health and also had a business impact. So this has been an evolving recognition program. And most recently, we're now looking to expand what the health project actually does beyond giving the Coop Award to organizations, which is still the Academy Award, the most prestigious award that organizations can get for having excellent programs. Last year, we introduced something called the Mattingly Award, which is specifically focused on mental health and well-being. So we just went through a round of reviews for that application. We'll be announcing those. And who knows? I think the underlying theme here is that employers require and need recognition for things that they're doing well. And there isn't enough out there. We mostly hear about problems that are out there. But what about those organizations that are actually doing a really, really good job at attending to and responding to the needs of their employees? And why not recognize them? So that's kind of the third main bucket.
Yeah, so that's all, huh? Okay. Yeah, I mean, kind of looking at each of those, I think one of the big themes that, as you say, you and I have been focused on business, but the thing that business wants is they want kind of practical recommendations. So I've got money to spend. I have this issue. I'm happy to try to address this issue, not only because it's good for business, but I do actually care for the people in my workplace, my community. I do feel, after decades of working with employers, most of them have a lot of good intentions. They really do care about the people that they're with, and they understand that they're important workers too. So we've uncovered a lot of emerging themes over the years through all that data that you're talking about. And that's certainly a core premise. We want some evidence. There's a lot of opinions out there. There's a lot of vendors with opinions. There's a lot of consultants with opinions. There's a lot of academics with opinions. And I think I've worn all those hats at some point. But what would you say, this is going to be a tough one, but of the key recommendations or lessons learned around employee health and well-being and this new emerging kind of realization that people actually, have emotions and other social needs, what's emerged for you that's either been surprising or just still a theme that people seem to miss?
I think you've hit the nail on the head there in terms of employers wanting answers. And, unfortunately, they want an answer tomorrow that will produce results the next day. So they're very impatient and they're very, gung-ho, tell me what to do, I'll do it. All right, did it work? The reality, of course, to change people, to change populations, to change opinions, behaviors, and societies takes effort, especially if you're talking about culture, which is actually a very important underlying theme in all employee health and well-being programs. So they need someone to do the translation of the research into conversation messages that they understand. And, I'm sure you've heard this before. Can you put it on one slide, or can you give me a one-page executive summary of what I should do? I don't want 50 pages. So our role has been to translate the science as best we can to fit the needs of the employer, but also to be very cognizant of their specific unique situation. So if you're a high-tech firm, Google, you're going to be different than Walmart. You're going to be very different than, somebody who's doing oil and gas extraction. So you can't walk in and say, yeah, here it is, here are the solutions. Let's figure out what's going to work for me. So there's a lot of tailoring and accommodation that's needed in those solutions. But on a broad basis, and this is actually the foundation for our NIOSH Center of Excellence, we call it the Poe Center, not just because Edgar Allan Poe comes from Baltimore, but because POE actually stands for something. So P is the psychosocial and personal dimension. In other words, you need help with your depression. You need help with your anxiety. You need help in being resilient. You need help in managing your time, managing your money, managing your social relations, and so forth. You need those kinds of skills and resources and apps and whatever it takes to help you figure that out for yourself. O is organizational health. So how toxic or non-toxic is the organization? Does it provide you support? Does it provide you time off? Does it not send you emails in the middle of the night and expect you to respond at 4 a.m? Does it expect you to be in the office on the weekend? Does it expect you to work 90 hours a week? So there's a large organizational factor in there, which encompasses culture and leadership and policies and programs and norms and routines and traits and traditions and so forth, rituals. And then there's the E, the environmental. Okay, so I'm now working in a lovely place. I'm actually working out of my house, which I I'm up in Massachusetts, and it's terrific. It's lovely. I got air conditioning if I want it. I've got heat if I want. I've got the kitchen. I got the bathroom. I can walk out and take a walk. But not everybody is as privileged as I am. So some people are working in very hot environments or very cold environments. They may be in a space where their fellow employees right next to them and they haven't taken a shower in 3 days. And, that's a problem. They may be exposed to COVID and they don't want to be exposed to COVID and bring that home with them. There are chemicals in the air. The air is bad, the water's bad. So those are environmental hazards and issues. Just the physical design of where you work makes a huge difference in temperament. Do you have a window you can look out? Do you have trees outside, or do you have a cement wall, or you're stuck in the basement? So if you look at these interactively, essentially, the personal psychosocial, the organizational, and the environmental, and think about it as a checklist. Here are the things that I can do to address each of those. But it's not just enough to give you a yoga mat and say, all right, now you're back to work and everything's great. And yeah, you still have to work 90 hours and have a terrible boss. So, those are, I think, something we've known all along, but we've never actually thought about it as a grand idea. You don't have to do everything in all those buckets, but you have to do something in each of those buckets.
Yeah, I like that kind of acronym to think about it, those three areas. And obviously, you could go very deep in each of those. So let me ask you, I think it would probably fit into the P, the individual one, but getting a little tactical. So, I'm pretty hot on this idea of health literacy these days. So getting back to kind of the healthcare system and how people interact and understand their own health and others. I've got a degree in public health and health education, and I started actually in a patient education company and was always kind of focused on this idea of participant burden with reading and everything, and have been somewhat disappointed, sounds judgy, but I have found that we're stuck in like a brochureware, what I call health literacy 1.0, when we know the literature is so strong that if people are more health literate, better outcomes, better experience, all the rest. And in fact, the CDC has redefined health literacy in terms of two buckets, one being organizational, meaning does the organization write in a low lit way, culturally sensitive, all of that, but personal health literacy, having the skills, knowledge, and confidence to navigate your own health journey. I call health literacy 2.0 this idea of taking the brochureware, flat, kind of boring, what everybody pictures health education to be, to using behavioral science and gamified learning, data for personalization and continued improvement, and multimedia. Everybody learns via YouTube. So why aren't we having little videos and infographics and then deep curriculum? So those three pillars bring us to this health literacy 2.0. Again, EdLogix is sponsoring this. They're one company that has operationalized this, but there are others out there. But I'm curious to get your point of view on where you think this fits in this equation. You've done a lot of research. You've kind of found a lot of, we use gaps and barriers and all these things. There's a lot of gaps, but for me, this is a big gap. The literature says only 1 in 10 Americans are really competent in health literacy. Now we have 2030 healthy people goals around health literacy. But when I talk to companies, they kind of go, oh, it's a good idea. I get it. But I don't know where it would fit in my ecosystem, where it would fit in my POE, where it fits with my vendors. Talk to me a little bit. Am I out there? Is this like something for other people, or is this a good idea? Should employers be thinking about it? Curious to get your take on it.
No, I think it's a great idea. Anytime you're educating people about anything that's important to them, their families, it's a very good idea. So I think certainly health literacy about basic things like what to eat, how to eat, and things like that, physical activity, smoking, and the list goes on, the risk factors that we're used to. In terms of medical encounters, that gets a little tricky for a few reasons. Number one is when you go see a doctor for something that ails you, you largely rely upon that doctor to know what he or she is doing and saying and telling you. And so if they say you need to go to the hospital right now, or you need surgery right now, or you need this pill right now, or you need this medicine right now. You're not going to argue often. I mean, I think you can go in equipped with background information that you come into the meeting and say, I've studied this and here's what I've found, or I don't think that's the appropriate treatment for me. But doing it on your own is really hard. Having an advocate with you, having somebody who's a family member who may be more conversant, more knowledgeable, especially in kind of acute situations, is very, very helpful. But I'm a proponent of getting educated, learning as much as you can about health. It's a super complicated area.
It's so interesting because I have gotten some pushback like, oh, the doctor is kind of the knowledge base. But we know
Yeah,
the doctor only spends a very limited amount of time. Even when they're great, I forget it all.
yeah.
Even when they're great, I still want to learn more about it. I'm exposed to the internet. I'm exposed to my family. They tell me I have diabetes. I need to better understand what that is, how it works, learn more about it. I have high blood pressure. What is it, et cetera. And being my own advocate, being my own family's advocate, having all this information around it, not to undermine the providers,
Mhm.
but to date, they're really not giving us that information. No blame to them per se, but
Mhm.
just the system's not equipped. I've been told that, hey, if there was a code for this, if there was more, funding
Mhm.
to educate people, we do more. And there are some codes for it, but it's pretty challenging. But I feel like some of the recent polls say that employees trust their employer a huge amount, very high level, maybe right after doctors. And so if employers can help provide credible information, would that not make sense?
It would, I think, like any other training education program they offer, and I think many of them do that, learn about diabetes, learn about heart disease, learn about asthma, sunscreen and so forth. And employees gravitate towards those are that are health conscious. Sometimes it's the worried well, but in general, it's people who care about their health and the family's health. Doing it on company time, providing social abilities, to share ideas with other people, even providing incentives, t-shirts, mugs, hats, and so forth, is a way of getting them to learn about these things. So basic things that you mentioned, like diabetes, hypertension, heart disease, and so forth, preventing cancer. Absolutely, I think that's important. Reading a pill container is one of the needs out there. People don't know how to take their medicine and don't follow through on that. And just asking doctors to give them written information instead of just verbal information, I think is useful. But I think, all that you're doing makes a lot of sense.
Yeah, it's interesting. You mentioned the pill thing. So numeracy is a very big factor
Mhm.
in all of this. And we have some little quizzes and games. There are lots of ways, but a lot of people that are challenged when you give them a couple numbers, like, take such and such with 8 ounces of water at a number of days, and all those numbers that go with it. So yeah, it's a very interesting area and the conversation to be continued for sure. We are seeing, though, to your point about mental health, we're
Mhm.
seeing a lot of interest in understanding mental health and different aspects of it and how to manage stress and anxiety and even to some extent more clinical issues. People searching for that, people, maternal and child health issues. It's interesting, I do feel like the healthcare organizations have a big role in it. Health plans have a big role. Providers have a big role. But ultimately, whether we want to call it patient or consumer, having that skill set, I think is a big piece of the whole equation for sure.
I think the market opportunity is for health plans that are budget driven. Basically, here's the money that you have for this quarter, this year to manage your patients. How are you going to spend that money? And I would spend it on health education, wellness oriented activities to keep people out of the office, basically. Or if you need something from me, send me an email instead of you coming in or something, and I'll send you information on that. So fixed fee type of arrangements, and I know it's a bad word, managed care, but the old HMO model
Right,
of
right.
here's the amount you pay us a year to keep you healthy, and here's what we ask you to do is a very powerful incentive for the provider community, the health plan community to be involved. If you're still paying based upon reimbursement and utilization, how many times you come into the office and how many procedures I perform, we don't need that.
Yeah, there's no incentive there. It's also interesting from, I see it as a big part of health equity. And I don't know
Mhm.
whether in your research you're doing a lot around health equity, relationship to well-being and diversity, equity, inclusion, belonging type of movements. But for me, there's certainly a disparity in access to care, but health literacy is also one of those pieces to health equity. We're seeing a lot of companies want to help the community as well. And promote health literacy as a way to help the community and in turn create a better business
Mhm.
environment, basically, as well.
I'm a strong proponent of community health workers. Actually, one of my early jobs back in the 1970s was mental health worker. So I was at that time just a bachelor's trained staff member of this organization up in Harlem. I would go out with psychiatrists and social workers and so forth to take care of the community. But most of the people working in the mental health center were community health workers, people with high school and bachelor's degrees. So I think having that kind of resource available, because teaching people stuff is hard. They don't have the time, they don't have the inclination, numeracy, that you just talked about. They don't have the math skills to do things. But if you have other people who know the system, who can guide you, can walk you through it and support you in those efforts, I think that's very much appreciated.
Yeah, and I think that's going to be a big movement. We saw that as you alluded to COVID and some of the things that happened, but I think having community health oriented types of mental health workers to be able to help people understand the resources available to them and is becoming more and more popular as well. So, Ron, we've covered a lot of ground. You've come up with some very interesting themes we talked about, but in closing, any couple, two, three things that maybe we missed that you really want to highlight, or a couple things we've talked about that you want to just reinforce for people that are, trying to genuinely make these efforts to improve the health and well-being of the populations with which they work?
I do want to reinforce this triumvirate, let's say, of the Poe Center, which
Yeah.
is don't just focus on the personal psychosocial elements of populations, focus on the organizational elements. And there are lots of tools out there, anywhere from the HERO scorecard, CDC scorecard, American Heart Association scorecard, a few others that focus on organizational health. And then the environmental aspect, unfortunately, they're viewed as occupational health and safety people and engineering and things you have to do to prevent accidents, but they actually have a huge influence on the health and well-being. So the POE type of
Mhm.
configuration, I think
Yeah, I
is
really
important
like
to keep
that. It's pretty
in
easy to
mind.
remember. Yeah.
Easy to remember, and if you think about it that way, you bring in a lot more people who are engaged and involved. The other thing, and I just wrote an essay about this, somewhat inspired by our conversations over the year, is to introduce more fun into the workplace. Our industry, by and large, has been very risk oriented. You're going to die if you don't do the following. And here are all the bad habits that you have, and here are the things you got to change. We have not focused enough on fun things that we can be doing at work together socially that kind of introduces things to our brain that make us feel good. And the feeling good is half the battle of actually physically being in good health. So I think more fun, more comedy, more joking, more things that you can do, like going into the woods, having fun with your family, turning off your Twitter account, whatever it is that will make it more fun for you. Let's do more of that. And let's make sure every meeting has jokes in it and people are playful at it without it going into the aggressive mode, of course. But yeah, let's just enjoy the time that we have with one another, be with friends, hang out, and do things that are enjoyable, that are fulfilling to us.
I really appreciate that. Yeah, I know you solicited a bunch of things in your way to building out your essay. So I don't know that I've seen the final product, but I love the idea of fun. I had an employer at the end of the day. We've gotten a whole conversation about this, and he goes, "Yeah, but it's got to be fun or people won't do it." And you and I have enjoyed the shared sense of humor. Not everybody gets it, but gets our sense of humor. But
Right.
one of my favorite books lately is the Book of Joy. It's a retreat with the Dalai Lama and Desmond Tutu. It sounds like the beginning of a joke, right? But
Yeah,
it
right.
actually happened. And there's kind of seven themes that they come up with, but one of them is humor. And the
Uh-huh.
Dalai Lama apparently is a big jokester. He likes to kind of do practical jokes and, kind of have fun and kid around. And I think we do forget that sometime, that it's hard, but let's have some fun. Let's poke around. I mean, it's hard. Some people say, politically incorrect. I think there's still plenty of room to have some fun and be nice and play a little bit more, be a little more playful and enjoy the creativity. So I think that's a perfect note for us to close on, Ron. Again, thank you so much. I look forward to seeing you in a month or so at the Hero Conference. I hope everybody could join us. But thanks again, Ron. Really appreciate it.
Thank you for inviting me to this podcast. All the very best to you.